Hi, everyone. Welcome back to another episode of Ask Dr. Ted. It is March the 14th. It's a Tuesday. It's a little windy outside, so if you hear the wind in the background, it's the weather. And first of all, I want to commend you for watching this one. Of all the videos I've done, this one will be the most important. I was going to say it may be. No, it will be the most important one. The number one thing that I need to talk to you about is heart attacks. They are very, very real. Remember that old saying, it's as serious as a heart attack. There's a reason they say that. So welcome back once again, and we're going to go into this. I'm going to ask some questions, and then I'll do my little presentation talk, and then we'll talk about them again at the end. I've got 6 questions here. See if you know these. The number one killer of men over 50 years old is heart attack. Number 2. The number one killer of women over 50 is heart attack. Number 3, men usually die of heart disease 10 to 15 years earlier than women. Number 4, if you are having a heart attack, you will always have chest pain as a warning sign. Number 5, if you or someone you are with has a heart attack, you should immediately call 911. Number 6, what one thing can you do immediately, right there on the spot, with somebody having a heart attack, which could save their life? Okay, by the end of this, you'll know the answer to all these, and you'll be a little bit of an expert, okay? So first of all, before we go into exactly what a heart attack is and how to treat it and all that kind of stuff, first of all, we all know certain rules, right? Like this one, like it says, electrical wire and water together, it's a very, what does it say? Very hazardous matter, right? We all know you can't stand in water or have wet hands when you touch electricity because electricity will travel through water and it can shock you, right? So with that in mind, let's say somebody that you know has a heart attack. Maybe you are having chest pain and you're having a heart attack, and the first thing that's going to happen is you'll go to the hospital, and the first thing they'll do is they'll hook you up to one of these things. This is an EKG, electrocardiogram, and you can see what they're doing. Let me grab my little pointer. What they're doing is when your heart beats, it creates electrical currents that travel from the bottom or inside your chest to the top of your skin. And you can put these little electrical sensors on you, and we can pick up the electrical impulses that your heart is doing, a couple of inches below the chest skin wall surface. And we can see, based on this little tracing and the one he's holding right there, we can see what your heart's doing. And if the electrical system is misfiring or in some kind of weird rhythm or the waves look different, we can see if you're having a heart attack. Now, here's the scary thing. Everybody thinks when you have a heart attack that you're going to have chest pain, right? And that's probably the most common. 75%, 3 out of 4 people will have chest pain. But guess what? 1 out of 4 will not have chest pain. They'll come in with unusual symptoms. Like they say, I'm just having a hard time catching my breath. I have seen hundreds and hundreds of heart attacks, and I've seen even probably thousands that we thought were heart attacks, but they ruled out. And they'll come in and say, sometimes they'll say chest pain. And chest pain, when you cut off the blood supply to the heart, the blood vessels that feed the heart, the chest pain you feel will feel heavy, pressure, tight. And they'll say, it just feels, no, it's not a heart attack. It just feels like an elephant sitting on my chest. It feels pressure. I feel this heavy chest pain. That's the typical thing, but 1 in 4 will not feel that. They may feel short of breath. That's a very common one. They just say, I just think that can't catch my breath. Or they'll say, man, all of a sudden in just a minute or two, I suddenly started feeling so exhausted. Like when you turn the dimmer switch down on the light switch. You know how you can turn it up and the light's really bright and you can turn it down? And they say, it just feels like somebody turned that down. And do you have any chest pain? No. Do you have any shortness of breath? No, I'm just exhausted. When did this happen? Just, a couple hours ago. And they kind of fight and don't want to come in. And then finally their wife usually makes them come in. We always say that rule number 1 is wives save husbands. And that is so true. And sometimes husbands save wives. But again, men have way more heart attacks than women do at an earlier age. Women can have them too. By the way, the answer to our questions. Number 1, the number 1 reason you can die in America, if you're a man older than 50, is a heart attack. The number one reason a woman can die is a heart attack. It's not cancer. It's not a stroke. It's heart disease. It's a heart attack. And we'll talk about it. That's why this is so important to learn this. Okay. What was another one of our questions? Let's go over let's see. Yes, men usually do die of heart disease 10 to 15 years earlier than women. And then women catch up when? After menopause. Estrogen that women make, they make estrogen, that seems to keep your arteries protected against heart disease. Now, I've seen women have heart attacks at an early age, but there's no question men get them earlier than women because men don't have that estrogen protecting them as much. And testosterone can also increase your risk of heart attack. Okay, and then number 4, if you are having a heart attack, you will always have chest pain. No, we've already talked about that. Sometimes people will come in and they'll say, I'm just getting this weird neck pain, or I'm getting pain in my jaw, or in my shoulders, or down my arms. And everybody knows left arm pain is bad. Guess what? Right arm pain is even worse. We're learning more and more, right? We didn't used to have cell phones. We have these now. Well, we're learning a lot about the body and how to diagnose these things. And it come to find out that right arm pain is worse than left arm pain if you're thinking they might have a heart attack. Okay, if you or someone you were with has a heart attack, you should immediately call 911. That is true. The only other thing you might think of doing first is the last question. What one thing can you do immediately, right there, on the spot with somebody having a heart attack, or you just think is having a heart attack, which could literally save their life? The one thing you can do, and maybe some of that you know this, my brother-in-law had 2 serious heart attacks, and I've known dear friends that have had heart attacks. One lives just down the street, a dear friend. They happen daily. If I work a 12-hour shift, at least once or twice I'll see chest pain. And rarely do we not see a heart attack at least once or twice in a week. And I'm in rural America, way up north near the Canadian border. We get them on a helicopter and fly them to the big city where you have a heart specialist to take care of them. We don't mess around. It's a serious deal. And so the one thing you can do is give them an aspirin. I am not kidding you. It's that simple. Give them an aspirin. And here's the key. You don't just have them swallow it. You have them chew it, right? Right here. These are regular strength aspirin. If you can see, 325 milligrams, wherever it is. There it is, 325 milligrams. We in the ER, we have them take 4 baby aspirin. They're 81 milligrams. When you take 4 of them, it equals 324 milligrams because they're better. They taste better, and people like to chew them better than they do a regular aspirin. But have them chew. It doesn't matter if it's a generic aspirin, Bayer, Excedrin, Anacin, Bufferin, any of these. Aspirin, and we'll talk about why. You have them chew it and then swallow it. It makes a difference if you chew it or not, okay? So the first thing you're going to do is when you go to the hospital, they're going to do the EKG, and we can tell within seconds. Whoops. I lost my place here. We can tell within seconds if you're having a heart attack because of the electrical system of your heart misfiring, and we can pick that up on the surface of the skin. The next thing they'll do is they'll hook you up to a monitor like this. And those of you that have had heart attacks, you know exactly what we're talking about, right? It shows waveforms on here. It shows how fast your heart rate's going. It shows your blood pressure. And let me just tell you a couple of stories. I had one about a month ago. A guy came in with a heart attack. He just said, I feel tired. I'm just tired. He was about my age. He wasn't old. I'm 59. And he just said, I'm just feeling tired. And I wasn't even sure if I should come in. He waited a few hours, and finally he came in. He called and just drove himself in. Which is a no-no, by the way, but he was by himself, but that's still a no-no, and we'll talk about why. So he drove himself in. We got the EKG. It looked totally normal. His EKG, that electrocardiogram, those wires were completely normal. So then the other test we do is they draw blood from your arteries, because if an artery in the heart gets clogged, everything downstream with no blood supply will die. And those muscle cells, millions or thousands at least of muscle cells that die, they release those enzymes inside the muscle cells of the heart that beat normally. It releases them into the blood. And sometimes you'll pick it up within minutes. Sometimes it takes 2 hours or 3 hours. So we always draw one blood test and then we wait 2 or 3 hours and we draw another one. If they're both negative with the high sensitivity blood test called troponin, then, and your EKG is normal, then we say, well, whatever it is, it wasn't a heart attack. That one of those two things would have been weird, your EKG or the blood test, especially if you wait 2 or 3 hours and do a second one. So we did his first one, or we did EKG, totally normal. We did the blood test, it was high. It was really high, and I couldn't even believe it, and he looked fantastic. His blood pressure was great, his color was great. He didn't have chest pain, he just felt really tired. And we called the helicopter and got him out of there. And they saved his life. Cardiologists save lives probably more than anybody. Maybe cancer doctors, right? But cardiologists do miracles. Okay, so let's talk about what a heart attack is. Here's a picture of your heart, of a heart, right? And look at the one thing around your heart that people don't realize. On the outside of your heart, here's our modern technology here. I'm using a cell phone and an iPad. So look at this fat. Your heart actually has fat on the outside like this. It's actually important for your heart for functioning. These are blood vessels on the outside of your heart. These are the blood vessels when your heart pumps blood, right? Your heart is just a hollow muscle and it fills with blood and then it pumps it out. Then it fills with blood and pumps it out. And when it fills with blood and pumps it out, it goes out of your aorta and then goes to your head and your neck and arms. And the first place it goes, it makes a U-turn and goes right back to the heart. The heart is the first thing that gets fed when your heart beats. It's the most important thing. If your heart doesn't work, it doesn't really matter how good your eyes work or your kidneys or anything else. Your heart is your ticker, they call it, right? And there's a reason. So the heart gets fed first. But here's what happens with a heart attack. Now let's take that same heart and let's cut it in half. Now you can see the inside of the heart. And there's those chambers. Like we said, it's a hollow muscle that beats, right? You have the chambers on top called the atrium, just like the atrium of a building, the high building rooms. And you have the ventricles at the lower end. The atrium beat, and they go through one-way valves. Blood can only go one way, and it can't go backwards. It beats from the top, then it beats from the bottom, and beats the blood to your lungs and your body. And look at these little things right here, these little yellow wires. Those are the electrical system of your heart. Your heartbeat starts up here in a thing called the sinoatrial node, or your atrial node, and it sends an electrical impulse down to the AV node between the atrium and ventricles, and it's kind of slow, and then it immediately takes the highway and shoots these impulses down to both sides of the heart, and it suddenly makes the heart beat. Just like when you flick a light switch and the light turns on, right? When this hits this, it makes your heart beat. And that's what we're picking up on that EKG. We can see if the electrical system's working. So let's say you have a heart attack like right here, right? Where there's no wires, or right here, or over here, or over here. That guy's going to be, he'll come in, or that lady will come in and say, gosh, I've got this weird heavy chest pain, or my jaw hurts, or my shoulders and arms are hurting, or I'm exhausted. And they will be able to survive their heart attack because they're not hitting the electrical system. But what if you have a heart attack right here? Everything downstream will misfire or not fire at all. What if you have one right here where both of these wires that go to the left side and the right side, what if you have a heart attack right there? Those are the scary ones. We all have heard of people, or we know people. My best friend I grew up with, he had a massive heart attack and he never had a chance to call 911. It was tragic. And he was young. And that's what's so scary. That's why this is so important that we learn what these things are and what causes them. So there's one of the reasons you call 911. You do not get in your car and drive. You do not have your wife or your husband put you in the car and drive, because I have seen people come in and they're saying, I've got chest pain, and maybe they're having a heart attack right there, right on the electrical system of the heart. And it's like somebody just flicking the light switch and the light's out, and they'll suddenly go unconscious right in front of you. I've seen it in the ER many times. You'll be talking to them, and all of a sudden, or their family member will come running out and say, he's not breathing. And we go in there and they're in that ventricular fibrillation, right? Instead of the doot, 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 because their heart's beating, it's that, which means that the electrical system is shot or it's misfiring, or it's like a short in the wire, or your TV or your remote doesn't work, right? And you have to turn it off and turn it on, and suddenly it works. If you turn it off and turn it on, it'll work again. If your heart starts to go into that fibrillatory pattern, your blood pressure drops to 0 and no blood pressure to your head or your brain, you're unconscious. And you get 4 to 6 minutes to get that started again. And you know what we do to get it started again? You probably already know. We use one of these, right? This is the old school. You put the paddles on and you shock them. They love to do this on TV. This is really exciting. Nobody uses that anymore. If you do, that's an old hospital. What we use nowadays is this. We use these little gel pads, and we put them on the right and the left upper chest and your right, or front to back, and we turn up the thing and we charge it, and then we push a button, and it sounds just like this. You say, everybody clear, and it goes, and they'll jump just like on TV. And you know what it does? It sends this electricity from one pad to the other. In fact, it sends it down and then back. It's called biphasic, once and then back. And when you do that, it's like slapping somebody in the movies when so you slap them and they're acting crazy, and that shakes them out of their craziness, and then you get their attention, right? It's like slapping the heart. It's like Control-Alt-Delete, or turning your computer off and turning it on. And after a few seconds or 30, 40 seconds, your heart will start beating again. That little quiver will start beating again. And so while they're doing that, they're doing CPR, and you stop everybody to shock the heart. That's why you call an ambulance, because unless you have one of these in your car and you can drive and do this at the same time, what if they crash while you're driving? You can't save them. And so you call an ambulance because they have this kind of equipment with them, and they'll get there fast. They'll save your life. When we talk about strokes, completely different. If it were me and I had a stroke, you go to the biggest, fanciest hospital you can find with an interventional neurologist or a neurosurgeon, because time is brain, and same thing here, time is heart. So you never drive yourself to the hospital with a heart attack. You call an ambulance in case this goes from beating to suddenly quivering. They can bring you back to life by shocking you. They have that in the ambulance. So there's the answer to that question. Give them an aspirin and call 911, and then let them come and do their job. And they know if it's a heart attack, they'll get them quick and get them to the hospital, and they get the pads on them, and they're watching them like a hawk. So what causes a heart attack in the first place, okay? That's what happens if you have one. Here is a picture. I guess we'll hold it like this. If you look at this, this says from first decade. When we're born, babies don't even know how lucky they are. They have these beautiful, open, clean arteries. And let's say this is an artery that goes to your heart, right? It's the same if it was an artery that went to your eyes or your brain or your kidneys or your legs or arms. All the arteries, there's several layers. They have muscles in here, so the muscles can squeeze the blood vessel or relax and make your blood pressure go up or down. When you're born, you have these nice, clean arteries. And look, even the first decade, look at this. They're already starting to get a little bit of cholesterol, or that fibrous cholesterol tissue in the lining of their artery when they're just kids. It starts early. There's no way you could know that's happening when you're in your first decade. From third decade, and look, between, your kid, then you start having macaroni and cheese and hot dogs, then you go to, high school and college, and you get married, and you start having, you just have your life, and stress and other things happen. And look, these cholesterol can get in between these cells. If you think about your heart, it's not just a plastic thing. It's made up of thousands or millions of cells, each individual cell, and then they hold hands together and they collectively beat, right? And so in between those little things, cholesterol can get in there and start clogging that artery. And that's what happens without you even knowing it. And this can happen, and it goes in first. And look, here we are from the fourth decade. Look at this. This is only in your 40s. Look at that cholesterol. Look how much more narrow that opening is for blood. Blood normally travels through here. They haven't drawn the blood in, of course. But that guy is going to have chest pain right here, or this guy, if he starts trying to go hiking, or he's playing pickleball. I had a dear friend that went and played pickleball and then had a heart attack. So, and my brother-in-law was doing P90X. Have you ever tried to do P90X without pushing pause? I've done it, but I pushed pause like 20 times. He does it straight through. And after he did that massive exercise program, then he had a heart attack. So what happened? How can you be exercising 1 minute and then have a heart attack the next? So one way is it happens slowly, and these guys, the lucky ones, get symptoms. They say, man, when I climb the stairs or when I exercise, I get chest pain. And then they'll go into their doctor and he'll say, well, let's put you on the treadmill, and they'll have you run on the treadmill. And if you can't run, they'll inject medication into your vessels that makes your heart rate speed up, right? When you're exercising, they speed it up and they make the incline go up, and you're breathing, they work you. And if you start having chest pain or your blood pressure drops, they hook you up to all this machinery while you're exercising. If your blood pressure drops or you get some crazy rhythm or your waveforms change or you start getting chest pain, they say, whoa, stop right now. Then they take you to that cath lab and they put a catheter in your artery of your wrist or your groin, and they feed it up in the vein, they feed it up in your heart, and they inject it with dye, and they can see if your arteries are clean like this, or if they're blocked like this. And if they're blocked, they can put a little tube in there with a little screen metal stent, and they blow up a balloon and it makes the screen open up. Then they deflate the balloon and pull that catheter out, and that leaves the screen. The screen pushes all this cholesterol to the side and it opens up your artery. And then they pull it out. And I've had people say, the minute they blew that up and deflated it, I had energy like I haven't had in who knows how long, because they're living with arteries narrowed like this. The scariest one is the guy who's down, like my brother-in-law and this dear friend of mine. They were exercising. They're in fantastic shape. Their artery was only down here or even here. They're now learning that sometimes these little plaques, these little cholesterol plaques, they can break. There's two things that should never meet. Cholesterol, this little yellow here is cholesterol. Cholesterol and your blood. Blood hates cholesterol. As long as it's separated by this little... Can you see that little line right there, that little fibrous cap? And this one's really thin. This guy's not in good health because that thing could break. It's really thin. Some of the fibrous caps are really thick and they hardly have any cholesterol. That guy probably won't have a rupture of a plaque. But if that thing breaks, like this guy right here, let me get rid of that thing on the bottom of the page. See how that one's broken right there? If the blood and the cholesterol meet each other, it releases these chemicals that make platelets stick to the cholesterol. And then they release chemicals which make more platelets stick to them and more to them. And pretty soon, something that was mostly open, this is what happens when you have a low budget. Something that was mostly open, this guy could exercise, do fine, P90X pickleball, and suddenly that breaks or that breaks, and what was 50, 60, 70% open suddenly can become 100% closed or 99% closed, and that's the guy that suddenly has chest pain when a minute ago he was exercising, right? That cholesterol breaking. And just, here's a cartoon representation, right? You have a platelet adhesion. So here's the cholesterol. The little fibrous cap is broken, and you can see the cholesterol in the blood, they're now meeting, and you get these little platelet plugs, platelet adhesion. They stick together. Then they release chemicals that cause more platelets to stick to those, and pretty soon, within minutes, it could go from here. Look at this guy's probably, 60% open, and now completely blocked from just this darn thing breaking. So when you take an aspirin, what it does is it makes the platelets less sticky. They don't stick as well. Platelets are sticky when you have a heart attack. Aspirin makes them slippery. So then instead of going from here to here and here, if you take an aspirin, you might go from here to here and it stops. And you still have some blood flow, and you can save the heart downstream from that. If it gets to here, that's a clot. That no blood gets through there. Anything downstream dies. That's what aspirin can do. It is a miracle drug. Remember, we talked about it was invented in 1898. Okay, just for fun, look at this. Here's an actual electron microscope magnified like 100,000 times. What this used to be blood, and see these little green strands? That's what the chemicals do. They cause these little strands to suddenly form, and then it makes the platelets. These used to be platelets. Now they become fibrous strands. There's kind of a little platelet right there, and there's maybe one up there. But they make these fibrous strands, and look, the red blood cells get caught in there, and it makes a blood clot. That's what a blood clot looks like under an electron microscope. Platelets send out they get sticky and send out these little strands, and then it clots. And so no blood can get through that, right? That's a heart attack under a microscope. There's one more picture of it. Isn't that amazing what science has figured out? This used to be liquid blood, and then platelets cause these little fibers, and your red blood, see, there's some platelets right there. There's a platelet, there's a platelet. They're all shriveled up because they've been activated, and all these little ropes didn't exist a minute ago. Now they exist because the platelets formed them out of chemistry. Isn't that amazing what the body can do? And that's what a heart attack looks like under a microscope. And so there's your answer. You take an aspirin, you can keep those platelets sticky and keep blood flowing through that artery, and it can save your life, right? And by the way, here's one other thing. You'll see these in gyms or at airports or in the mall. They're AED. That stands for automated external defibrillator. It's just like that thing you put the paddles on and shock them. If somebody's having a heart attack and their heart goes into that quiver, they're beating, then it starts to quiver, you put this on them and then push the green button and just step away. It does it automatically, and it'll even talk to you. It'll tell you what to do. So if you ever see somebody go down, ask where the AED is, and they'll usually know, and you could hook it up, and you could literally save somebody's life. I've watched people literally dead on the table, their heart's quivering. It happened right in front of us. We hook up, not this one, but that other one with the pads. We shock them, and they literally wake up. One guy woke up and said, "Man, what'd you do? That really hurt." And he knew. And his wife was standing right there and saw the whole thing, and she goes, "Good job, you guys." That is an honest truth thing. That happened on Christmas Day one time, like 20 years ago. It's that real. That's how serious heart attacks are. So if you know what to do, right, you call 911 and give them four baby aspirin or a regular aspirin, have them chew it and then swallow it, and call 911 and then just let them take it from there. If you know what to do, that's the difference between this. They literally go home and they just pick up right where they left off. They live their normal life. They can live 20, 30 more years. Once they fix that, they're at more danger than anybody else. Or if you don't know what to do, sadly, right, this happens all too often. So remember, and if you have somebody in your family that you might be worried about, have them watch this and just let them know what it is. This is why we go to the doctor and why we have aspirin and we call an ambulance. You don't try and, "Oh, I got chest pain, I'm not going in." The biggest problem is when people feel the symptoms, they get chest pain or they can't breathe or they feel pain going down their arm or into their neck or face, and they say, "It's nothing, I'm not going in." You would not believe how many times we've been fooled. We think it's not a heart attack. Then when you do the EKG and the blood test, it turns out positive. It surprises us all the time. You cannot guess. These are life or death issues, right? And risk factors that make you more likely to have a heart attack. Number one is your family history, right? You can outrun a lot of things, but you can't outrun your genetics. If your mom or dad had heart disease, a heart attack, or some arrhythmia, rhythm problem, especially at an early age, you will likely follow suit. You get your genetics from them. So you start seeing your doctor in your 30s or 40s and talk to them. So family history, high cholesterol. The higher your cholesterol, the more those arteries can clog. Smoking, that one, nobody should smoke. Smoking makes those arteries, in fact, let's just go back to our picture here. Remember this scary picture? Guess what can make you go from these nice, clean baby arteries to these clogged arteries? What can make that happen way faster? Genetics, nothing you can do about that. Being a man, testosterone, women have estrogen, that's protective. Can't do much about that. Smoking, much faster. The earliest heart attack I've ever seen was a 39-year-old guy who was a smoker. That was it. He was skinny, he had good health other than he smoked, and he had a heart attack at 39. He did okay. He was the one that passed out, and we shocked him, and he came back, and his wife says, "Good job, you guys." And we flew him out of rural Utah to the big city, and they saved him. Diabetes can make this, uncontrolled diabetes. If you control your diabetes and keep your A1C and your blood sugar in normal limits, and you see your doctor, once a year, twice a year, make sure that's the case, you don't have to worry. You'll stay up here. High blood pressure is another one. So diabetes, high blood pressure, cholesterol, those are things we can control. You want to stay here. You don't want to stay here. And they have medications that can make this little fibrous cap See how thin that guy is? He's just a ticking time bomb. That thin little cap is going to break one day, and sure enough, there it did. And you get that clot again. Which way? You get that clot from that cap breaking. Well, guess what? They have medications that make that fibrous cap really thin, get thick, and it won't break. And it literally can save your life from, you'll never have a cholesterol plaque break. So medications are key, and they really do work. There's no question. When they study these medications, they'll put 5,000 in a group that take the medicine and 5,000 in a group that takes a sugar pill. Nobody knows which is which. The doctors and the patients, nobody knows. And they always stop the study early because they say, my word, the ones taking sugar pills are dying much higher rate than the ones taking these medications that can save their lives, like cholesterol, diabetes, high blood pressure. These really are things that are life-saving. Just as real as this phone works, these medications work, right? This is the modern miracle that we live in these days. Amidst all the struggles, we do have some good things. So hopefully that will help. Have somebody watch this. If somebody's had a heart attack, let them watch it, and they'll go, yep, I remember that, I remember that, I remember that. And never drive yourself to the hospital, because you could go from heartbeat to ventricular fibrillation in the car, in traffic, and there's nobody there to shock you back. An ambulance can. Ambulance, those EMT people, we love them. They save more lives than anybody. They are a different breed. If you can work on an ambulance, my daughter Madison is doing this. They're a different breed. They love this stuff. By the time they get to the ER, they're awake again. They're not bleeding anymore. The arm's reattached with duct tape. They look way better when they get to me in the ER. The EMTs see them when they're all over the place and they're unconscious or they're having a seizure. So God bless the EMTs, the ambulance people. We love them. And firefighters and police, all you guys. Thank God that you're there. Anyway, thank you so much for watching, and we'll see you next time. Bye-bye.